Medical Assistant Exam Scheduling Questions. Question 1. For a patient encounter in a community health clinic, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, wave scheduling. Option B, stream scheduling. Option C, prior authorization. Option D, matrix blocking. The correct answer is option A, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Stream scheduling assigns patients specific individual appointment times. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Question 2. The care team in a treatment room asks for guidance because a patient asks for a copy of their medical record. Which action should the assistant take? Option A, follow the office release of information process. Option B, give the record to anyone who asks. Option C, delete sensitive information before the request is reviewed. Option D, refuse because records belong only to the provider. The correct answer is option A, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Identity and authorization must be verified before disclosure. Altering the record is inappropriate and may violate legal requirements. Patients have rights to access their health information under applicable rules. Question 3. During a primary care office, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A, skip precautions if the patient is already taking medication. Option B, use only sterile gloves without a mask. Option C, place the patient beside an immunocompromised patient. Option D, apply droplet precautions and offer a mask according to protocol. The correct answer is option D, apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Treatment does not remove the need for appropriate precautions. Sterile gloves do not protect mucous membranes from respiratory droplets. Separating symptomatic patients helps reduce transmission risk. Question 4. Following office protocol in an internal medicine office, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A, ignore the error even if it affects care. Option B, make an addendum according to office policy. Option C, ask a coworker to change it under their login. Option D, delete the original note completely. The correct answer is option B, make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Clinically important errors should be corrected through proper procedures. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Question 5. For a patient encounter in a walk-in clinic, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, difficulty swallowing. Option B, excessive thirst. Option C, painful or difficult urination. Option D, ear inflammation. The correct answer is option C, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Difficulty swallowing is dysphagia. Excessive thirst is polydipsia. Ear inflammation is otitis. Question 6. The care team in a community health clinic asks for guidance because blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A, remove the tourniquet and continue filling all tubes. Option B, gently adjust the needle position while maintaining safety. Option C, probe aggressively until blood returns. Option D, label the empty tube as collected. The correct answer is option B, gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Without blood flow, the collection cannot continue effectively. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Question 7. As part of exam preparation in an exam room, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, explanation of benefits. Option B, advance directive. Option C, sterilization log. Option D, progress note. The correct answer is option A, explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. An advance directive communicates future care wishes, not payment information. A sterilization log tracks instrument processing, not claim payment. A progress note documents clinical care, not insurance payment decisions. Question 8. To protect safety in an electronic health record review, a complete blood count is ordered. Which tube is most commonly used? Option A, red tube with no anticoagulant. Option B, lavender tube with EDTA. Option C, light blue tube with sodium citrate. Option D, gray tube with fluoride oxalate. The correct answer is option B, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. A red tube allows clotting and is not the standard choice for a complete blood count. Sodium citrate is used mainly for coagulation studies. Gray tubes are used for tests such as glucose or lactate depending on protocol. Question 9. Before the visit continues in a pediatric clinic, a staff member shares an electronic health record password to save time. Which risk is created? Option A, automatic insurance approval. Option B, better sterilization monitoring. Option C, a loss of accountability for chart access. Option D, improved privacy protection. The correct answer is option C, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Question 10. At the start of care in a certification exam scenario, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, clean and dry the puncture site according to protocol. Option B, skip patient identification because the test is quick. Option C, puncture through visible dirt. Option D, use the first visibly dirty drop for every test. The correct answer is option A, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Patient identification is required even for quick point-of-care tests. Contamination can affect the sample and infection risk. Site contaminants can affect the first drop depending on protocol. Question 11. Following office protocol in an infection control audit, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, skip technique instructions because home cuffs are automatic. Option B, record readings with date, time, and relevant notes as directed. Option C, use another person's readings if the cuff is shared. Option D, write only the highest number ever measured. The correct answer is option B, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Readings must belong to the patient. Selective recording can mislead clinical decisions. Question 12. To protect safety in a community health clinic, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, auscultation. Option B, venipuncture. Option C, prior authorization or referral process. Option D, autoclaving. The correct answer is option C, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Auscultation is listening to body sounds and does not approve visits. Venipuncture is blood collection and does not authorize insurance coverage. Autoclaving sterilizes instruments and is unrelated to payer approval. Question 13. At the start of care in a specialty referral visit, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, verify the recipient fax number before sending. Option B, leave the fax confirmation on a public counter. Option C, send it to a number from memory without checking. Option D, include unrelated patient charts in the same fax. The correct answer is option A, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Confirmation pages may contain protected information and should be handled securely. Memory errors can lead to misdirected protected information. Only necessary information should be disclosed. Question 14. In a diagnostic testing area, a rapid strep test requires a throat swab. Which technique is best? Option A, swab the outside of the lips. Option B, touch the tongue repeatedly to collect saliva. Option C, collect sputum from a deep cough. Option D, swab the tonsillar area and posterior pharynx while avoiding the tongue. The correct answer is option D. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. The lips do not provide the specimen needed for strep testing. Saliva and tongue contact can dilute or contaminate the specimen. Sputum is not the specimen used for a rapid strep throat swab. Question 15. The care team in a same-day appointment asks for guidance because the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, above normal. Option B, below normal or deficient. Option C, against. Option D, before. The correct answer is option B, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Above normal is indicated by hyper. Against is indicated by anti. Before is indicated by pre. Question 16. Given the workflow in an outpatient laboratory, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A, below normal. Option B, around. Option C, above normal or excessive. Option D, between. The correct answer is option C, above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Around is indicated by peri. Between is indicated by inter. Question 17. To protect safety in a procedure setup, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A, movement changes the patient's blood type. Option B, the electrodes are used only to deliver medication. Option C, the machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option D, a movement can create artifact that makes the tracing harder to interpret. The correct answer is option D. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Movement has no effect on blood type. Electrodes detect electrical activity and do not deliver medication during a standard recording. Normal breathing is usually allowed, but excessive movement should be avoided. Question 18. Following office protocol in a cardiology practice, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, lavender EDTA tube for serum. Option B, gray fluoride tube for all serum tests. Option C, light blue citrate tube for serum. Option D, a red or gold serum tube. The correct answer is option D, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Gray tubes are not the standard serum tube for routine chemistry panels. Citrate anticoagulant is used for coagulation testing. Question 19. Given the workflow in a patient education session, a claim requires the code for an office visit procedure or service. Which code set is used? Option A, zip code. Option B, ICD-10-CM. Option C, policy number. Option D, CPT. The correct answer is option D, CPT. CPT codes describe medical procedures and professional services. A zip code identifies location and is not a procedure code. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. Question 20. The care team in an urgent care office asks for guidance because a provider orders spirometry in the office. Which patient action is required? Option A, follow instructions for a strong, complete breathing maneuver. Option B, talk continuously during the maneuver. Option C, remove the mouthpiece before starting. Option D, hold both nostrils and refuse to exhale. The correct answer is option A, follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Question 21. As part of exam preparation in an outpatient laboratory, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Describe the diagnosis in detail on the message. Option B. Leave limited information and a callback number. Option C. Demand payment details with full medical history. Option D. Leave another patient's results for comparison. The correct answer is option B. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Detailed clinical information may be heard by unauthorized people. Excessive information violates privacy and may not be necessary. Sharing another patient's information is a privacy breach. Question 22. During a treatment room, the term cardiology appears in a referral. Which specialty is involved? Option A. Heart and cardiovascular system. Option B. Kidney disorders. Option C. Digestive disorders. Option D. Skin disorders. The correct answer is option A. Heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Nephrology focuses on the kidneys. Gastroenterology focuses on the digestive system. Dermatology focuses on the skin. Question 23. At the start of care in an electronic health record review, the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A. Filter lymph. Option B. Transport oxygen. Option C. Produce bile. Option D. Create antibodies as their main role. The correct answer is option B. Transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Lymph nodes filter lymph rather than red blood cells producing this function. Bile is produced by the liver and stored in the gallbladder. Antibody production is associated with certain white blood cells and plasma cells. Question 24. As part of exam preparation in a phlebotomy station, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Perform blind finger sweeps immediately. Option B. Encourage coughing and monitor closely. Option C. Leave the patient alone until they stop coughing. Option D. Give the patient food to push it down. The correct answer is option B. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Question 25. Given the workflow in a telephone triage workflow, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Follow office policy and patient communication preferences. Option B. Post the reminder on social media. Option C. Ignore all reminder preferences. Option D. Text any diagnosis to any phone number in the chart. The correct answer is option A. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Public posting would expose private information. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Question 26. During a same-day appointment, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Change only the paper on the exam table. Option B. Clean and disinfect touched surfaces according to office protocol. Option C. Spray disinfectant and wipe it off immediately every time. Option D. Open the door to air out the room only. The correct answer is option B. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. Question 27. When a patient encounter unfolds in an infection control audit, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A. Height and weight. Option B. Oxygen saturation and pain score. Option C. Pulse and respirations. Option D. Blood pressure and temperature. The correct answer is option A. Height and weight. Body mass index is calculated from height and weight. Oxygen saturation and pain score provide different clinical information. Pulse and respirations are vital signs but are not used to calculate body mass index. Blood pressure and temperature do not determine body mass index. Question 28. The care team in an infection control audit asks for guidance because a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, Sims. Option B, prone. Option C, supine. Option D, Fowler. The correct answer is option C, supine. Supine means lying on the back facing upward. Sims position is side lying with one knee flexed. Prone means lying face down. Fowler position is seated or semi-seated. Question 29. For a patient encounter in a patient education session, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, delete all pharmacy information from the record. Option B, leave the old pharmacy because it is already in the chart. Option C, choose the pharmacy closest to the clinic. Option D, update the preferred pharmacy after verifying the new information. The correct answer is option D, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Removing needed information can interrupt prescribing workflows. Outdated demographic information can delay medication access. The preferred pharmacy should come from the patient rather than staff convenience. Question 30. Before the visit continues in a family practice clinic, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A, document that the patient requested it and proceed. Option B, perform it because any provider request is automatically legal. Option C, ask another assistant to do it secretly. Option D, clarify the concern and follow legal scope of practice requirements. The correct answer is option D, clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Question 31. While working in a procedure setup, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, wave scheduling. Option B, open hours. Option C, double booking. Option D, clustering. The correct answer is option C, double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Question 32. Following office protocol in a primary care office, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, using sterile forceps for sterile supplies. Option B, keeping sterile items above waist level. Option C, reaching across the sterile field with an unsterile sleeve. Option D, opening the wrapper away from the body first. The correct answer is option C, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Question 33. In a walk-in clinic, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, ureter. Option B, axon. Option C, platelet. Option D, alveolus. The correct answer is option B, axon. An axon carries nerve impulses away from the neuron cell body. A ureter carries urine from kidney to bladder. A platelet is a blood component involved in clotting. An alveolus is a lung air sac. Question 34. For a patient encounter in an internal medicine office, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, ask another patient in the waiting room to consent. Option B, follow state law and office policy for consent requirements. Option C, refuse all care without considering exceptions. Option D, assume all minors can consent to every service. The correct answer is option B, follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction. so policy must be followed. Other patients cannot provide consent for the minor. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Question 35. The care team in a same-day appointment asks for guidance because a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option B. Eat a heavy meal immediately before every test. Option C. Wear tight clothing that restricts breathing. Option D. Ignore all provider instructions about inhalers. The correct answer is option A. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Medication instructions should follow the provider or testing protocol. Question 36. At the start of care in a family practice clinic, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Fast breathing. Option B. High blood sugar. Option C. Inflammation of the liver. Option D. Slow heart rate. The correct answer is option D. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Fast breathing is tachypnea rather than bradycardia. High blood sugar is hyperglycemia. Inflammation of the liver is hepatitis. Question 37. In a busy front office, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the assistant's initials with no service information. Option B. Only the room number. Option C. Only the patient's favorite color. Option D. Procedure code and diagnosis or reason for the service. The correct answer is option D. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Initials alone do not provide billing codes or medical necessity. Room numbers do not describe the service or diagnosis. Personal preferences do not support claim coding. Question 38. During a diagnostic testing area, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A. Coinsurance posting. Option B. Sterile field setup. Option C. Order of draw. Option D. Matrix blocking. The correct answer is option D. Matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Coinsurance posting relates to patient financial responsibility. Sterile field setup supports clinical procedures, not schedule blocking. Order of draw guides blood collection sequence. Question 39. Following office protocol in a treatment room, a patient feels faint during a blood draw. Which response should occur first? Option A. Leave the patient alone to find paperwork. Option B. Finish filling the tube before responding. Option C. Tell the patient to stand up quickly. Option D. Stop the procedure and protect the patient from injury. The correct answer is option D. Stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. A faint patient should not be left unattended. Continuing the draw can worsen the situation and increase injury risk. Standing can worsen faintness and lead to a fall. Question 40. A medical assistant is working in an exam room when a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A. 5 milliliters. Option B. 10 milliliters. Option C. 1 milliliter. Option D. 0.5 milliliter. The correct answer is option D. 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 5 milliliters would provide 500 milligrams at this concentration. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 1 milliliter would provide 100 milligrams. Question 41. Following office protocol in an exam room, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A. Use the oldest card in the file without asking. Option B. Code every visit as preventive care. Option C. Skip registration for returning patients forever. Option D. Verify insurance eligibility at each visit according to policy. The correct answer is option D. Verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Old cards may no longer reflect active coverage. Coding must reflect the service and documentation. Returning patients can have changed insurance or contact information. Question 42. When a patient encounter unfolds in a patient intake station, an electronic record uses an audit trail. What is its purpose? Option A. Track who accessed or changed information. Option B. Sterilize instruments automatically. Option C. Approve insurance claims instantly. Option D. Measure blood pressure. The correct answer is option A. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Vital sign measurement requires clinical equipment and technique. Question 43. A medical assistant is working in an urgent care office when a subcutaneous injection is ordered. Which site is commonly appropriate? Option A. Abdomen with adequate subcutaneous tissue. Option B. Deep into the deltoid muscle only. Option C. Directly into a vein. Option D. Into an area that is bruised and inflamed. The correct answer is option A. Abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Intravenous administration is a different route and is outside a subcutaneous injection. Bruised or inflamed tissue should generally be avoided. Question 44. At the start of care in an exam room, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. No documentation is needed for symptoms. Option B. The assistant diagnoses pneumonia. Option C. Patient states, I have had a cough for 3 days. Option D. Patient is definitely exaggerating the cough. The correct answer is option C. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Symptoms are relevant to the visit and should be documented according to policy. Diagnosis belongs to the provider. Judgmental wording is inappropriate and not objective. Question 45. During a women's health clinic, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Finish all remaining patients before telling anyone. Option B. Place a bandage on the site and ignore it. Option C. Wash the area and report the exposure according to protocol. Option D. Hide the incident if there is no bleeding. The correct answer is option C. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Delaying reporting can delay needed evaluation and follow-up. Covering the wound alone does not address exposure risk. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 46. The care team in an urgent care office asks for guidance because a chain of custody urine drug screen is collected. Which practice is most important? Option A. Document each transfer and maintain specimen integrity. Option B. Skip signatures if the specimen looks normal. Option C. Allow the patient to take the specimen home first. Option D. Use an unlabeled container until the lab receives it. The correct answer is option A. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Unlabeled specimens can be rejected and cannot be reliably traced. Question 47. To protect safety in a community health clinic, a mask becomes wet during patient care. Which action is appropriate? Option A. Replace the mask according to infection control practice. Option B. Share it with a coworker. Option C. Keep wearing it for the rest of the week. Option D. Dry it on the clean supply shelf. The correct answer is option A. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Masks are not shared between staff. Extended use of a wet mask is not appropriate. Used masks can contaminate clean areas. Question 48. The care team in an exam room asks for guidance because a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, gray tube. Option B, lavender tube. Option C, blood culture bottle. Option D, light blue tube. The correct answer is option A, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Lavender EDTA is used mainly for hematology testing. Blood culture bottles are used to detect bloodstream microorganisms. Light blue citrate is used for coagulation studies. Question 49. At the start of care in a treatment room, a patient says they cannot afford a prescribed medication. Which response is best? Option A, tell the patient to stop all medications. Option B, ignore the comment because finances are private. Option C, notify the provider or appropriate staff so alternatives can be discussed. Option D, suggest sharing medication with a friend. The correct answer is option C, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Sharing prescriptions is unsafe and inappropriate. Question 50. During a primary care office, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, tell the patient to bring personal gloves only. Option B, use latex-free supplies and clearly communicate the allergy. Option C, ignore the allergy if the procedure is short. Option D, use powdered latex gloves because they are easier to put on. The correct answer is option B, use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. Question 51. The care team in a pediatric clinic asks for guidance because a patient needs crutch walking education after provider instruction. Which principle is important? Option A, body weight should rest mainly on the armpits. Option B, crutches should be used only on wet floors. Option C, the patient should skip follow-up if pain increases. Option D, crutches should fit properly and not press into the axilla. The correct answer is option D, crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Weight should be supported through the hands, not the axilla. Crutches are mobility aids and wet floors increase fall risk. Worsening symptoms should be reported according to instructions. Question 52. For a patient encounter in a certification exam scenario, a tickler file is used in the office. Which purpose does it serve? Option A, sterilize instruments. Option B, measure oxygen saturation. Option C, track future follow-ups or reminders. Option D, draw blood into tubes. The correct answer is option C, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Question 53. While working in a treatment room, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, ignore it because it is not in an exam room. Option B, wait until a patient reports slipping. Option C, cover it with loose papers. Option D, place a warning sign and arrange cleanup immediately. The correct answer is option D, place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Prevention should occur before an injury happens. Loose paper can worsen slipping and does not clean the hazard. Question 54. To protect safety in a quality control review, the provider is running behind and a patient asks for an update. Which response is professional? Option A, tell the patient that waiting is their only option. Option B, discuss another patient's emergency as the reason. Option C, apologize for the delay and provide the best available estimate. Option D, guarantee an exact time even when it is unknown. The correct answer is option C, apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Dismissive communication is unprofessional. Sharing another patient's situation can violate privacy. False certainty can create more frustration. Question 55. As part of exam preparation in a primary care office, a claim requires the code that explains why a service was performed. Which code set is used? Option A, NDC only. Option B, ICD-10-CM. Option C, CPT. Option D, place of service only. The correct answer is option B, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Place of service identifies setting, not the medical reason for care. Question 56. During a preventive care visit, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A. Ask the patient to sign a blank form. Option B. Leave it because both patients use the same clinic. Option C. Delete the form and tell no one. Option D. Report and correct the filing error according to policy. The correct answer is option D. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Blank forms do not correct the misfiled record and are inappropriate. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Question 57. In a procedure setup, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Give a diagnosis over the phone. Option B. Follow emergency triage protocol immediately. Option C. Tell the patient to send an email later. Option D. Schedule the patient for next month. The correct answer is option B. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Question 58. For a patient encounter in a patient education session, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A. Urinary bladder. Option B. Appendix. Option C. Gallbladder. Option D. Thyroid gland. The correct answer is option D. Thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 59. An office review in a diagnostic testing area shows that the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Air in the lungs. Option B. Blood in the urine. Option C. Protein in the stool. Option D. Sugar in the blood. The correct answer is option B. Blood in the urine. Hematuria means blood is present in the urine. Air in the lungs is not described by hematuria. Protein in stool is not hematuria. Sugar in the blood is described by glycemia terms. Question 60. Before the visit continues in a phlebotomy station, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Blow on the site to speed drying. Option B. Touch the vein again with an ungloved finger. Option C. Draw blood while alcohol is still wet. Option D. Allow the alcohol to dry completely. The correct answer is option D. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Wet alcohol can sting and may affect specimen quality. Question 61. At the start of care in a procedure setup, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A. Coinsurance. Option B. Copayment. Option C. Referral. Option D. A remittance address. The correct answer is option A. Coinsurance. Coinsurance is the patient's percentage share of covered costs. A copayment is usually a fixed amount rather than a percentage. A referral is permission or direction to see another provider. A remittance address tells where payments or documents are sent. Question 62. When a patient encounter unfolds in a cardiology practice, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It replaces all insurance forms. Option B. It is used only to schedule appointments. Option C. It communicates the patient's wishes about future medical care. Option D. It allows the assistant to ignore provider orders. The correct answer is option C. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Advance directives do not replace billing or insurance documents. Scheduling is unrelated to the purpose of an advance directive. Care decisions still follow legal, clinical, and facility processes. Question 63. When a patient encounter unfolds in a pediatric clinic, a peak flow test is ordered. Which body system is being assessed? Option A. Urinary system. Option B. Respiratory system. Option C. Skeletal system only. Option D. Integumentary system. The correct answer is option B. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. Question 64. Following office protocol in an exam room, a sterile package is torn before a minor procedure. Which action is required? Option A. Tape the wrapper and use the contents. Option B. Use the items if they look clean. Option C. Consider the contents contaminated and obtain a new sterile package. Option D. Spray the package with disinfectant. The correct answer is option C. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Taping does not restore sterility after the barrier is compromised. Clean appearance does not prove sterility. Surface disinfectant cannot sterilize items inside a compromised package. Question 65. As part of exam preparation in a pediatric clinic, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A. Inside a visible vein. Option B. The fingernail bed. Option C. Deltoid muscle when the medication and volume are appropriate. Option D. A reddened rash site. The correct answer is option C. Deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. A vein is used for intravenous access, not intramuscular injection. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. Question 66. During a walk-in clinic, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A. Provide standardized guidance for office tasks. Option B. Guarantee every claim is paid. Option C. Replace all state laws. Option D. Eliminate the need for training. The correct answer is option A. Provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Policies do not guarantee pay or reimbursement. Office policy cannot override applicable law. Policies support but do not replace staff training. Question 67. To protect safety in an electronic health record review, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Remove the band so it does not worry the patient. Option B. Ignore the band if the patient seems healthy. Option C. Verify the allergy information in the record and with the patient. Option D. Give medication first and ask about allergies later. The correct answer is option C. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Allergies must be checked before administration. Question 68. Following office protocol in a medical office workflow, office supplies are consistently running out before the next order date. Which administrative action is best? Option A. Order random supplies without reviewing use. Option B. Wait until every item is completely gone. Option C. Hide supplies from the provider. Option D. Track usage and adjust PAR levels according to office needs. The correct answer is option D. Track usage and adjust PAR levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Unplanned ordering can waste money and storage space. Waiting can interrupt patient care and office workflow. Hiding supplies does not solve inventory management. Question 69. After reviewing the situation in a clinical skills review, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A. Move it over the venipuncture site. Option B. Tighten it further until the vein bulges. Option C. Ignore the time because tourniquets do not affect tests. Option D. Release it and allow the arm to recover before continuing. The correct answer is option D. Release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. Question 70. To protect safety in an internal medicine office, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Ask the patient to walk faster. Option B. Assist the patient to sit or lie down safely. Option C. Tell the patient dizziness is impossible. Option D. Leave the patient standing while searching for forms. The correct answer is option B. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Walking can increase fall risk when the patient is dizzy. Dismissing symptoms does not protect patient safety. An unsteady patient should not be left unsupported. Question 71. After reviewing the situation in a clinical skills review, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Open the chart if the coworker promises not to tell anyone. Option B. Deny the request because there is no job-related need to know. Option C. Share the chart because staff work in the same clinic. Option D. Print the chart and remove the patient's name only. The correct answer is option B. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. Question 72. At the start of care in a family practice clinic, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Ophthalmoscope. Option B. Spirometer. Option C. Otoscope. Option D. Speculum for pelvic exam. The correct answer is option C. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. An ophthalmoscope is used to examine internal eye structures. A spirometer evaluates lung function rather than the ear. A vaginal speculum is not used to inspect the ear canal. Question 73. To protect safety in a community health clinic, a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A. Laugh to lighten the mood immediately. Option B. Sit at eye level and allow silence when appropriate. Option C. Stand over the patient with crossed arms. Option D. Keep checking messages during the conversation. The correct answer is option B. Sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Humor can be inappropriate when a patient is distressed. Closed posture and standing over the patient can seem intimidating. Distracted behavior suggests the patient is not being heard. Question 74. To protect safety in a phlebotomy station, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A. 4. Option B. Subcut. Option C. IM. Option D. PA. The correct answer is option D. PA. PA means by mouth and is used for oral administration. 4 means intravenous and refers to administration into a vein. Subcut means subcutaneous and refers to injection into tissue under the skin. IM means intramuscular and refers to injection into muscle. Question 75. When a patient encounter unfolds in a diagnostic testing area, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A. The assistant's diagnosis before the visit. Option B. Only the patient's favorite pharmacy color. Option C. Another patient's insurance card. Option D. Demographics, contact information, insurance information, and reason for visit. The correct answer is option D. Demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. That information does not complete registration. Insurance information must belong to the patient being registered. Question 76. Given the workflow in a community health clinic, a patient wants information released to a spouse. Which documentation is usually needed? Option A. A verbal request from the spouse only. Option B. No documentation because spouses always have full access. Option C. A valid authorization or permission according to office policy. Option D. A note written by the assistant after the fact. The correct answer is option C. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. The spouse's request alone may not authorize release. Relationship alone does not automatically grant full access to records. Authorization should come from the patient or legal authority. Question 77. While working in a certification exam scenario, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Use it because the cap is still attached. Option B. Guess the opening date from memory. Option C. Mix it with another vial to avoid waste. Option D. Follow facility policy and do not use it if safety cannot be verified. The correct answer is option D. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. Question 78. When a patient encounter unfolds in an administrative check-in area, a patient asks which body system includes the skin. Which system should be identified? Option A. Endocrine system. Option B. Urinary system. Option C. Integumentary system. Option D. Respiratory system. The correct answer is option C. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The endocrine system is made of hormone-producing glands. The urinary system filters blood and eliminates urine. The respiratory system supports breathing and gas exchange. Question 79. To protect safety in a community health clinic, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask the patient to state 2 identifiers and compare them with the order. Option B. Use the room number because it is faster. Option C. Label the tube after returning to the lab. Option D. Ask a family member to confirm the name only. The correct answer is option A. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A room number can change and is not considered a reliable patient identifier. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A family member may be mistaken and one identifier is not enough for positive identification. Question 80. During an electronic health record review, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Suggest using a friend's medication. Option B. Recommend doubling the dose instead. Option C. Tell the patient to stop immediately. Option D. Refer the question to the provider. The correct answer is option D. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Sharing medication is unsafe and inappropriate. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Question 81. In a procedure setup, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Cover the spill with an exam table paper. Option B. Ask a patient to avoid stepping on it. Option C. Wipe the spill with a dry paper towel only. Option D. Use appropriate personal protective equipment and an approved disinfectant. The correct answer is option D. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Covering a spill does not remove or disinfect the hazard. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Question 82. Before the visit continues in a women's health clinic, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A. Premium. Option B. Deductible. Option C. Copayment. Option D. Adjustment. The correct answer is option C. Copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. A deductible is the amount the patient pays before insurance begins paying according to the plan. An adjustment changes the billed amount based on contracts or corrections. Question 83. At the start of care in a preventive care visit, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Cover the mouth while speaking. Option B. Face the patient and speak clearly at a moderate pace. Option C. Shout from another room. Option D. Assume the patient cannot participate. The correct answer is option B. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Covering the mouth removes visual cues. Shouting from a distance reduces clarity and privacy. Hearing difficulty does not mean the patient cannot understand or decide. Question 84. The care team in an administrative check-in area asks for guidance because a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Leave the tube unmixed until pickup. Option B. Shake the tube forcefully. Option C. Open the tube and stir with a swab. Option D. Gently invert the tube the required number of times. The correct answer is option D. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Question 85. At the start of care in a family practice clinic, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Speak quietly and avoid announcing sensitive details. Option B. Place all charts open on the counter. Option C. Ask other patients to help verify the record. Option D. State the full diagnosis loudly to confirm the visit. The correct answer is option A. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Open charts may expose protected information. Other patients should not be involved in private verification. Announcing diagnoses in public can violate confidentiality. Question 86. In a patient intake station, a pain score is being collected during intake. Which approach is best? Option A. Assume pain level from facial expression only. Option B. Ask the patient to rate pain using the office's standard scale. Option C. Tell the patient pain is not part of vital signs. Option D. Change the score to match the assistant's opinion. The correct answer is option B. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. Pain assessment is commonly included in intake workflows. The pain score should reflect the patient's report. Question 87. As part of exam preparation in a clinical skills review, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. Immediately. Option B. By mouth. Option C. Every morning. Option D. As needed. The correct answer is option D. As needed. PRN means the medication is taken as needed according to the order. Immediately is stat in common medical usage. By mouth is PA. Every morning is commonly abbreviated differently and is not PRN. Question 88. A medical assistant is working in a quality control review when the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A, ventricular repolarization. Option B, kidney filtration. Option C, atrial depolarization. Option D, ventricular depolarization. The correct answer is option C, atrial depolarization. The P wave represents electrical activation of the atria. Ventricular repolarization is represented by the T wave. Kidney filtration is unrelated to electrocardiogram waveforms. Ventricular depolarization is represented mainly by the QRS complex. Question 89. A medical assistant is working in a phlebotomy station when an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Give oral medication before checking responsiveness. Option B. Begin CPR and use the automated external defibrillator as directed. Option C. Wait for the provider before starting any response. Option D. Use the defibrillator on a conscious patient asking questions. The correct answer is option B. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Oral medication is unsafe when cardiac arrest is suspected. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Question 90. As part of exam preparation in a pediatric clinic, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Activate emergency response and assess breathing according to training. Option B. Offer water by mouth immediately. Option C. Finish documenting the previous visit. Option D. Move the patient to a chair before assessing. The correct answer is option A. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Question 91. During a patient intake station, a patient makes a complaint about care received in the office. Which response is most professional? Option A. Argue until the patient stops complaining. Option B. Post the complaint online for staff opinions. Option C. Listen respectfully and follow the office complaint process. Option D. Delete documentation related to the complaint. The correct answer is option C. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Arguing escalates conflict and is unprofessional. Publicly sharing patient concerns can violate confidentiality. Destroying or altering records is unethical and may be illegal. Question 92. During a medication administration visit, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Discard the tracing to avoid alarming the patient. Option B. Give the tracing to the provider promptly according to protocol. Option C. Change the tracing to make it look normal. Option D. Diagnose the rhythm for the patient. The correct answer is option B. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Altering medical records is unethical and unsafe. Medical assistants should not provide a cardiac diagnosis. Question 93. Following office protocol in a quality control review, coordination of benefits is needed. Which situation does this usually involve? Option A. A provider orders a throat swab. Option B. A patient has one cash payment only. Option C. A patient has more than one insurance plan. Option D. A patient needs a sterile dressing. The correct answer is option C. A patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. A throat swab order does not itself involve multiple insurance plans. One cash payment does not require multiple plan coordination. Dressing supplies do not create coordination of benefits by themselves. Question 94. In a medication administration visit, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Ignore the return time. Option B. Keep a diary of symptoms and activities as instructed. Option C. Remove electrodes whenever symptoms occur. Option D. Submerge the monitor in water. The correct answer is option B. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. The monitor must be returned as scheduled for data review. Removing electrodes can interrupt recording when data are most important. Water can damage the device and create safety risks. Question 95. Following office protocol in a women's health clinic, the term dermatology appears in a referral. Which specialty is involved? Option A. Heart. Option B. Blood. Option C. Kidney. Option D. Skin. The correct answer is option D. Skin. Dermatology is the specialty focused on skin conditions. Cardiology focuses on the heart. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Question 96. Before the visit continues in an internal medicine office, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A. Use tape only and skip electrodes. Option B. Apply electrodes directly over lotion. Option C. Clean and dry the skin before applying electrodes. Option D. Move all chest leads to the abdomen. The correct answer is option C. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Tape cannot record cardiac electrical activity. Poor adhesion can cause artifact or lead loss. Incorrect lead placement changes the tracing and may impair interpretation. Question 97. While working in a procedure setup, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. 5th intercostal space at the left midclavicular line. Option B. Midway between V2 and V4. Option C. 4th intercostal space at the right sternal border. Option D. 4th intercostal space at the left sternal border. The correct answer is option A. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V1. That location is used for V2. Question 98. When a patient encounter unfolds in an electronic health record review, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Correct the date of birth without asking anyone. Option B. Use the appointment time as the identifier. Option C. Stop and resolve the discrepancy before proceeding with care. Option D. Continue if the last name matches. The correct answer is option C. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Question 99. Given the workflow in a specialty referral visit, the suffix itis appears in a medical term. Which meaning is most accurate? Option A. Inflammation. Option B. Pain. Option C. Removal. Option D. Study of. The correct answer is option A. Inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Question 100. At the start of care in a telephone triage workflow, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Painful urination. Option B. Slow pulse. Option C. Rapid breathing. Option D. Low temperature. The correct answer is option C. Rapid breathing. Tachy means fast, and near relates to breathing. Painful urination is dysuria. Slow pulse is bradycardia. Low temperature is hypothermia.